Okay, friends, welcome to my YouTube channel. That sounded very strange. I am not used to speaking at a phone or a camera. I've done some public speaking in the past, and that was a little frightening, considering that I am a person with diagnosed with generalized anxiety and PTSD. Those things tend to create some anxiety for me. So I wanted to start off by giving a warm introduction to myself and my channel and my intention for all this. First, I am Fanny, and I think the name on my channel kind of sums what I am looking forward to delivering through my channel. And literally, it's just my experiences with certain areas of life. I want to give a disclaimer first as well. I am not a nail tech. I have been practicing doing nails, inspired by my sister, who is also not a nail tech. Well, she's done various courses and that kind of stuff, but that's not her profession, neither mine. But as I share life with you guys and talk about all sorts of things, I will be working on nails because this is another part of my therapy treatment. And I have made it that, not my therapist or any psychologist. I feel very soothed by creating and sculpting nails and working on art. As you see here, this is not perfect. Again, I am not a nail artist, licensed nail artist. This is not my profession. I do my own nails to save myself some money, and I work on my girl Bonnie's hand. Bonnie is the practice hand. I named her Bonnie. She's my sister's hand, but she let me borrow her when I became a bit more interested in doing my own nails and practicing on Bonnie. So Bonnie is going to come along with us in this journey, and please don't come after me if you don't like my nail art. Like I said, I'm not a nail artist. I don't tend to be one. This is just therapeutic for me. So is the ability of and having the courage to start this YouTube channel and sharing a lot of stuff that has led me to this point in life of sharing with you some of the things that I've been challenged with over the last 3 years, especially. I will dive deep into so many topics. But again, I just wanted to give you a nice warm up here of introduction and let you all know that I am not a psychologist. I am not a counselor. I am not a doctor. I am none of those. I'm not giving anyone any recommendations, professional recommendations, consultations, you name it. So I will just be speaking from personal experience, sharing things about my life and struggles here that, I don't know, I hope I can connect with some of you out there and that you will relate and maybe make you feel validated with certain things, encourage you, empower you, inspire you. There's just so many things I can think of. I really hope that I truly can connect with some of you, and I look forward to hearing from you, your feedback. I'm not for the negative stuff, although I know that exposing myself and sharing a lot of the things that I will share will perhaps trigger people in some way. In no shape or form, that is my intention. I come from a place of sharing my true life, my experiences from my perspective, and in my opinion on even just certain topics too out there. So please be, please just be very respectful and mindful that no one is perfect. And if I ever make a comment of some sort that is probably out of character or whatnot, I please call me out on it. And I could, evaluate that and then see truly, what that means, and if there is some sort of correction I need to make on my end. But I know beforehand that there is people that are extremely sensitive to a lot of things, and I am exposing myself and I'm putting myself in that pit, right? Where I can be easily targeted. But I have thick skin, and I'm not necessarily afraid or worried about that happening. I think that this is going to be a great place, a safe place to talk about things in womanhood, and even for men too. There's so many things that we can share and have a dialogue of. So I am going to cut it short. Again, I will be doing nails or probably building Legos. There's a lot of different things that I do on my quiet time when I want to do something therapeutic. And for the most part, it's either coloring books, sculpting nails, or building Legos, which is another passion of mine. So you'll start to learn a little bit about me as we go. So I feel like I have a few more minutes here, stepping into sort of maybe my goal for tonight. I want to open up that understanding of why I am vlogging. So about 3 years ago almost, I underwent surgery for endometriosis. For those who are not aware or understand what endometriosis is, I will share some videos of doctors who are professional and certified to explain it thoroughly. Just because endometriosis is not a one-size-fits-all disease, I do know that there is no cure for it. It's a disease that causes debilitating pain. It's essentially inflammation and chronic pain, mostly attacking women in their pelvic area. So I will share more about that, and I will do a video on endometriosis for my endometriosis sisters, my endo warrior sisters, I should say. I know that it is something that a lot of women don't share or talk about, because we're talking about our reproductive system, and that could be very hard for people, for women to share and talk about. So I want to spend some time on a separate video talking about that. So I am stage 4 endometriosis, and I also had adenomyosis, and that was just removed with a hysterectomy that I just got last November. I will also make a video on my experience and my journey getting that hysterectomy, which I know my endo sisters who are following will be very interested in maybe learning what my experience was. So 3 years ago, I went in for my first surgery where I had been formally diagnosed with endometriosis. Prior to that, I had spent about, I don't know, I want to say since my teenhood, I was maybe 15, 16 when I started to suffer, and sort of, I don't know, realized that there was something really wrong with my reproductive system. It, started with excruciating pelvic pain and irregular menstrual cycles, irregular, uh, you know, um, I guess, periods, pain, cysts, fibroids, I mean, even polyps at some point. So there is a lot to endometriosis. And so I had just one of the worst pain cases, in my opinion. I mean, there are times where I would have to go to the ER and I would have to, maybe stay over because I couldn't tolerate the pain. So that was very difficult for me. And I spent a little over 10 years suffering with that pain and being gaslighted by doctors, would say, hey, it's just a bad period. All women go through that. And just your typical endometriosis patient story. I'm 1 in 10, and 1 in 10 women who on average have to wait at least 10 years before they are formally diagnosed and begin to get treated. So that was definitely a challenge for me from my teenhood up until my adulthood. I am now 36 years old, and just barely 3 years ago, you guys, I was diagnosed formally. And I don't want to say that I regret my first surgery was for ablation and removing scar tissues and adhesions from, my pelvic area and my reproductive organs. I mean, when they went in, they mentioned that everything was stuck in a ball, like a large, ball of gum. Everything was stuck together. And from years of not having any, treatments or getting it removed or having some type of hormonal therapy to suppress. So I had I was immediately, diagnosed with stage 4. Again, I apologize. Maybe I'm diving too deep into the endo, and I want to have a separate video on that. But prior to my surgery for this, it was during the pandemic, or maybe a little later in the pandemic, maybe mid-pandemic, when I started to just feel that emotional and mental suppression of getting used to being locked down, just being limited on, the social events and just all of the changes that came with COVID, and how that really affected everyone emotionally and mentally. And I was one of the people who unfortunately, suffered a lot. But prior to my surgery, I, was just not feeling well emotionally and mentally. And I recall some symptoms of anxiety and, just, trouble sleeping and just feeling all of these physical symptoms of numbing and tingling around my body. And, um, but I didn't really think much of it. I kind of just went through life. And um, I want to say a couple weeks prior to my surgery, I recall just starting to have intrusive thoughts of, you know, just being scared of having surgery, thinking I was going to die or something bad was going to happen to me. So, kind of like the normal, stress, anxiety, thoughts, and again, I wasn't familiar with this, so I wasn't sure, never experienced anything like that prior. So, I was like, oh man, I'm just nervous because I'm going to have surgery and, I need to calm down and just, started to connect with like my spiritual side of praying, of, doing meditation. I mean, I would do all kinds of things just to kind of help with that. I also was dealing with like vertigo, which really created a lot of confusion for me. And I will talk more about that maybe on a separate video that just sort of describe specifically everything I went through, with my generalized anxiety, the PTSD, and all of my other emotional and mental challenges that I was dealing with at the time. So I go in for my surgery. Everything was fine. I had a successful surgery. Probably not with the specialist I wanted it, but overall, they were able to sort of put things back in place and help me, um, you know, um, have, I guess I could say, a brief, a brief, uh, time of no pain. And I say brief because months after my surgery, hell broke loose for me. And I will talk more about that later, or in another video. But essentially, I come out of my surgery. That was on a Wednesday. On Saturday, post surgery, I had what I called then, I thought I was having a heart attack or I was dying. I had this strange body flush, adrenaline, brain zap. I mean, there were so many things that were happening, and I did not understand exactly what was happening, but I was in so much fear. I was just so scared and paranoid in that moment. I remember just sitting there. I had relatives, my parents visiting, and my siblings. And I had my sister sitting next to me, and she asked, hey, are you okay? Like, do you need something? Like, milk. Like, bring me a glass of milk. I thought maybe I was overdosing on maybe some of the medications. Maybe I didn't take something right. Remember, I had come off anesthesia. I don't do very well with anesthesia. It's very hard on my body. So I thought about all these things that could possibly be wrong other than what was really wrong. So the effect just went away. The symptoms just went away. I panicked and I was very concerned until I remember calling the advice nurse that night, and they said, hey, just, keep calm. We think you're just, coming out of the effects of anesthesia, or kind of like what I had thought, right? And I let it go. And then again, on that following Tuesday, I was in my kitchen by that time I was sort of walking and being able to do normal things. And I was pouring myself some tea when this episode of adrenaline, of heart palpitations and body flushing, heat to cold to numbing, and all of these other symptoms started to occur again. And that was very scary. It was, oh my, it was very scary. I didn't think twice. I told my husband, we have to go to the ER. There's something seriously wrong with me. I'm gonna die, you know. And so I went to the ER. There was nothing wrong with me. All of my tests came back normal. I had a CT scan. My white blood count cells were actually higher than normal. That's a whole other story. I'm sorry, there's just so much to share. But that was very, very just strange. You know, they really didn't have an answer for me, you know, and that was frustrating and it was scary. 3 weeks pass. I had no symptoms. I was fine. I was very scared. I honestly was waiting for the next, what now I know it's called, panic attack, anxiety attack. And sure enough, I was at work, and I began to get, my heart started racing very, very fast. I started to get palpitations at the same time, and I got very lightheaded. I thought I was going to faint. I may have briefly had, I don't recall. I remember just screaming for a Coke and just forgetting about what I had in front of me, which, you know, was about 30 people in line to get their food from our, you know, catering business that day. And I did not care. I just sat there, and my husband is looking at me like, are you okay? And I wasn't okay. I began to cry. I began to just feel defeated. I felt overwhelmed by my symptoms and scared and paranoid, and I wasn't sure what was going on. So I finally went back to the doctors, and because after that day, the heart palpitations would not stop. So I went to the ER that night, and I had an EKG done. I had about 30 of those in 1 year. I'm not joking. I wish I was. It's on my chart. Because every time I would get them in a day nonstop, it was scary, and I would rush to the ER thinking that I was going to have a heart attack. And at that time, unfortunately, they still couldn't figure out exactly what was wrong with me until, you know, they got psychiatry involved, because I began to explain in thoroughly other symptoms that I was getting. Again, the biggest ones were the brain zaps, not being able to sleep, the intrusive thoughts, the numbing and tingling all throughout my face, and the heart palpitations were probably the biggest ones. The anxiety, the fear, the worriedness. I mean, and I had to undergo an evaluation, and sure enough, they're like, you know, there's nothing wrong with your heart, but we will keep an order for EKG. If you ever feel that you need to rush back, you know, there's going to be an order for you to have that performed. You know, if you feel like you're in serious, you know, cardiac arrest emergency or something. So basically, up until that point, I've heard of, anxiety. I had what I would call just normal anxiety. But I didn't know how much was sort of hidden, or tucked away, for lack of better words. When I went under for anesthesia, I guess weeks prior to that, my body was starting to sort of start to speak and release anxiety and stress that was accumulating. And with the pandemic and everything that was going on, I was sort of entering this stage in my life where I needed to address so many things, from birth to childhood, I guess. And my body was starting to speak to me, and I didn't really understood or didn't know what it was saying, or trying to tell me with these symptoms that I was getting very mildly, very, very mild. So when I went under, I had, unfortunately, this disruption in my brain that created this chemical imbalance. Is pretty much how my psychiatrist was able to help me understand. So it opened up a Pandora, right, of so many things. And she kind of said, and to help me understand, it's like, imagine you have this closet filled with all kinds of junk, and it's all unorganized, and it's just, there's a point you open that door and everything just like spills out, right? And we call those, let's just call them all of life trauma and experiences that have good or bad impact, mostly bad, of course. Those are the ones that are the most traumatic, from childhood to teenhood to adulthood and so forth. So she's like, this is where we organize things, fold things up, and we put them back in order. So since then, after that, I didn't get on any medication. I didn't get on any treatment of some sort. I was struggling with the idea of what exactly was going on. I was also going through a failed surgery. Like I said earlier, I had a brief moment or months or weeks where I was pain-free. And then before that surgery, I had pain once or twice a month, maybe 4 or 5 days out of it. That was excruciating. I went from just those days to every single day. And that brought on just more depression, more stress, more anxiety, more panic attacks. And in the midst of that, I was obsessed with finding a natural solution to heal, or I guess treat, my endometriosis, suppress the abnormal bleeding, suppress the pain. All natural, because before that, I tried to target things on a holistic approach. Just doing, herbs and, anything, vitamin, teas, food, drinks, and all of those things. I thought that was better for my body. And after that diagnosis, I spent almost about a little over a year trying to figure things out. through, a holistic approach. And I failed. I think that I made things a lot far worse for me, because if I was on the edge of maybe some sort of mental breakdown or psychotic breakdown, which I don't think it was that bad, but it felt like it. I think that becoming obsessed with advocating for myself naturally and in the medical industry for other reasons, it made it just far worse for me, because I opened the door. I created more symptoms that were extremely hard for me to handle and deal with at that time. So that was very, very, very hard, you guys. Until I finally gave up. My body was giving up. My body was speaking to me even louder, to the point where it was impacting my relationships with my loved ones. I was scared to go out. I was scared to go work. I thought at some point I'm going to drop dead, because these symptoms are so scary and severe. I'm going to drop dead. I'm going to die. This is going to kill me. I just knew that that would happen. And I didn't want to leave my home. I didn't want to leave my bedroom. I would get home. I would be strong. I would show up and work for a business. And I would come home and I would do the bare minimum and take care of my husband, our dog, which my dog was probably my saving grace without knowing it. And then I would just tuck myself in my bed, because that's where I felt safe. That's where I felt I had no symptoms. That's where I felt I had nothing to worry about or be scared about. And that's where I would hide until things just got worse and worse, because I wasn't happy at all with life. I wasn't enjoying myself. And, I could say that at one point I said to myself, I don't think I'm going to be able to live. I don't think I'm going to be able to deal with this endometriosis pain, with my emotional and mental issues. I don't think I'm going to be able to bear. And in 1 year, I remember I had a car purchase, my very first car purchase, with my name, my credit, my everything. And I wasn't happy. I wasn't happy. I wasn't excited. I was like, yeah, I just need it, right? And I said, who is not excited about buying a car? I never thought that that would be my experience. And months after that, I went on vacation, went to Disney World, the happiest place on earth. I was miserable. I would go to the bathroom. I felt so unsafe. I would go to the bathroom and I would just lay on the bathroom floor next to the stall until I could soothe myself to be able to go back out and face the fear of being out there and experiencing the heart palpitations, the lightheadedness, the vertigo, the just feeling so off, not feeling normal, of being scared for no apparent reason. The head pressure, the head heaviness, the just feeling like there's this rubber band tied around my brain. I mean, the fire that I would experience. All of these symptoms I was so afraid of, but for whatever reason, just being alone, hiding in a bathroom stall was a way to help. Mind you, I wasn't sleeping at night. I couldn't sleep. I was so frustrated. I wanted to sleep. It was so hard, you guys. And I spent a little over a year. And here I am today, 2 years after that first year. I understood that I couldn't live like that. that I needed medical intervention, that I no longer could afford to find any natural remedies because I'd spent a year of my life post diagnosis finding a natural remedy, and it never worked. I spent hundreds, if not thousands of dollars finding treatments, natural treatments, Tibetan medication, hypnosis, meditation, regression. I mean, you know, I didn't consult the devil because I'm being funny, you guys. Okay, I did not, but it's a joke that I always say. If if it was going to give me the cure and the solution, then I might have. But I'm kidding. I don't believe in that. But I just wanted to, make things a little light. And that was a way of doing it. But I kid you not, I consulted with so many people around the world and I couldn't figure it out until I said, this is not how I'm going to live my life. I either give up now and I don't know, is it going to kill me, or am I going to do it myself? Am I going to give up, or am I going to, seek medical intervention and get the help that I need? Because I knew that it was going to be one thing or the other. I knew that there was just no in between, no more. I couldn't do a year more or a month more, or even a week more. In fact, I was on my second vacation with my father and my sisters in Hawaii when I emailed my doctor and I said, you need to refer me to psychiatric for medication management and therapy and all the above. And that's exactly what I did, you guys. 2 years later, here I am. I want to share more about that and what I've done in terms of therapy. But it's been 2 years and it sounds like a lot, but I was just telling my therapist, we're going on our 3rd year weekly therapy of emdr therapy, for those who are curious, of being treated with medication that has helped me tremendously, you guys. I mean, from when I started, and this will take me to the next thing, I've met with my psychiatric my psychiatrist. I apologize. We talked about, kind of just looked back. They have their little fancy graphs where they show you where you started and where you're at now with, personal surveys where you answer questions of kind of where you're at in life, emotionally, mentally. And guys, I mean, where I started and where I'm at now, I mean, I have been saved by myself, by these 2 women that have really taken their time to care for me. And when I say time, I don't say that lightly, because every second and every minute we have spent working together has been just such a blessing, because it's been filled with deep care, with just the attentiveness, the way these women have helped me bring me back to a balanced state of mind. I mean, I can't thank them enough of how much they have done to help me lift me and save me. I mean, I honestly, I don't have any words right now, you guys, to describe, because obviously this is my first video. I am pouring my heart and life out here and I don't have the experience, so bear with me, please. If I missed maybe something that I left there hanging loose, please, you're welcome to share in the comments, or you can email me. directly. But I want to bring this video to an end here because I want to do a follow-up of what it's like to live with generalized anxiety and PTSD. There is, you know, a lot to share with endometriosis, a lot to share with just my journey in general. You know, there's just so many things that brought me to this point that that played big, you know, that played a big part in all of this that has led to this, you know, emotional and mental illness. So I know that with questions and follow-ups and all of things, and as I bring more topics, we can, you know, open a dialogue and share more and, you know, dig things out together. And like my therapist said, you know, rearrange things, fold them, and bring them back in that closet neatly. And that is what we're doing. Again, you guys, I am not a psychiatrist. I am not a counselor. I am not licensed professional in any of those fields or you know, PhD. I'm not a physician. I'm not a nurse. I'm none of that. I'm not an LTech licensed whatsoever. So please don't quote me on any of those, you know, things that I've shared. And I will do my best to give you better terminology on my diagnosis and all the other stuff, medications and such. Oh, Bonnie, I'm sorry. And be able to be as clear as possible and understanding as possible, because I think part of sharing is also sharing, but also being clear and for people to understand. So if something is unclear or not able to understand me, please let me know. I am going to work at that and maybe just kind of organizing my thoughts and what I want to, you know, point and, you know, get across to you in every video. I will continue and see you on the next video. I look forward to getting some feedback, and I don't know, thanks you guys. I truly appreciate your time. See you on the next video. Goodbye.